Hello everyone. So I'm making this video after a very long time, and the reason because NEET PG counseling is going on and I'm getting a lot of queries from NEET aspirants on my social media account, and it's very difficult to answer each one of them. Though I'm trying to answer, but it's very difficult. So I thought, why not to make a video and to give you the answers to your relevant queries. Now, before moving forward, I want to say that I'm really happy that I've seen a lot of messages coming to me that they want to pursue sports medicine as a branch or a career. But before moving forward, I also want to say that sometimes it could be a reason that the branch might look flattering to you from the distance because you're seeing and following someone on the media, or maybe they will see the pictures and maybe you want to yourself work in the sports. But before you choose a branch, decide in your head whether you are passionate about it or not, because the branch will stays with you forever. So you have to work consistently for the branch and for yourself as well. Now I will try to answer the queries which had been coming to me. So I will first start with the very first question, which is residency in Safdarjung Hospital, that is Sports Injury Center, with respect to type of work, working hours and the opportunities given for further work. Now residency in Sports Injury Center is relatively easy as compared to the other branches, because you are not dealing with the daily emergencies. So you are basically dealing with the daycare of the patients and also the OPD management of the patients in the OPD itself. The surgeries which are also happening in the sports injury centers are elective surgeries, which are mostly the ligament surgeries, be it of the shoulder or the knee. Now for the first year resident, you have to be associated yourself with your seniors, mostly for the perspective of ward works, maintaining the OT diaries, calling the patient and taking care of the bedside care of the patient. Now this is for the first years, but if you are lucky enough, you can get a chance to give the medical support in various games and tournaments. But after that comes the most important part, that whether you will get relieved from the department to attend those tournaments or events, which in most of the case scenario is difficult. Now comes the second part, which I always say is that whether you are passionate about it or not. Now why I'm saying it, because if you are not getting relieved from the department, you can still attend the tournament. Now what I used to do during my postgraduate residency was, I used to attend the tournaments after my PG hours. So I used to go there in the evening, attend the tournaments. You can go even during the weekends and when you are having a leave. Now, but you also have to at the same time maintain a balance between your postgraduate life and life which is outside of it, that is a sports life, that is a on-field life. Now comes the second important part, working hours. Now working hours in Sports Injury Center will start from 7 a.m. to 5 p.m. but it may vary depending upon the situation, depending upon the number of patients or the loads. But these are actually the specific duty hours. Now comes the second part of it, that how many night duties would be there. So it will also depend that how many residents in the first years are joining. But if I'll talk, I'll say that yes, 3 to 4 are the night duties in a month that will be there for the PG first years, because they are already second, third years PGs that have been present there. Now comes the second important questions that is coming to me is senior resident seats availability and the faculty seats, or maybe what are the career options, what are the opportunities after you are done with your post graduation. Now there are 3 opportunities that you can move forward with, or even I can say there are 4 opportunities as well. The first is always associated yourself with the academic institution. Now when I talk about the academic institution, that means you are doing your senior residency. Post that you can just apply for a job of faculty or assistant professor or professor. Right now in Safdarjung Hospital, there are ad hoc seats for senior residents and there is no seat for assistant professor and professor. But as the center is expanding, there are permanent seats for senior residents, professor and assistant professor is coming. Now South has got more job option as compared to the North region. That's why there are many number of people who had been working in the South region and they are doing relatively very good. Second job option that you can go for is Sports Authority of India. Now SAI will give more weightage to the MD and the diploma sports medicine people, and yes, you can join SAI, you can gain the experience and the expertise from the organization itself, but in my personal opinion, the job in SAI are not very much rewarding in terms of a long run, because most of the SAI centers, they lack basic facilities as well. Now comes the third part, that you can join the federation or leagues as a team doctor. Now many of my colleagues and my seniors had been working with the federations and the leagues, and I'm myself being the national team doctor for the senior women football team. Now how to join the federation will depend upon whether you want to contact the federation directly, and the other option is you can contact the people who had been working in the federation, be your colleagues, be your seniors, so they can guide you well, who had been working with the federations or the leagues for a very long period of time. And lastly comes the part that ease of the opportunities in subdivision hospital. Now the hospital is mainly dominated by the orthopedic, so yes, the tie-up with the federation and the organization is not being there. So most of the times the leagues, federations or whatever events that had been happening, they approach the center for the exposure of the residents for the upcoming event on tournament. Now if you are lucky enough to get the chance to get the relieving from the institution, it's good, but if you are not, again you have to maintain the balance between the two. Now being associated with the orthopedic department, the good thing about it is that from few days of your residency, you will be involved with assisting or observing the arthroscopic surgeries. So that is one important aspect of it. Now being associated with the orthopedic as a branch itself can teach you how to be clinically efficient in managing the patient and how to do a perfect kind of intervention. So I had been associated with the center since last 6 years, and I had been blessed to had my hands on tons and tons of patients to just get the expertise in terms of clinical management and the intervention itself as well, and not to forget about the arthroscopic surgeries. Now this is all what I need to answer about the queries. Aspirants can also message me their queries and I'll try to come up with more videos, because yes, the hectic lifestyle doesn't offer us to make the videos, but I hope this video would help the aspirants to choose the right path for themselves. Now before ending this video, I want to say two things. That I always say that life inside the institute and organization is relatively easy, and it's completely different from the outside, that you working in the on-field sports. But you should be ready to accept the challenges and the opportunities that is coming in your way. All the best for your future endeavors, and I hope to see a lot of people in sports medicine in coming years. Thank you very much.